It's Mike at the library again. I'm here with our library director, Kacie Armstrong, and a guest speaker who I'm extra proud and honored to introduce, Dr. Marcus Germany. He has a special place in the hearts of all of us at Euclid Public Library because not too long ago, he was one of us. While attending Euclid High School, right next door, Marcus took a job as a page at the library. That's one of the people you see sorting and shelving all the returned library materials. And I never saw Marcus without a smile on his face, never heard anyone say a bad word about him, and still haven't. In fact, one person who went to high school with Marcus and also worked here with him recently told me, that man is a saint, when I told him Marcus was going to be doing a program with us. Marcus dreamed of becoming a doctor then and is making it come true. He graduated from the University of Cincinnati with a doctorate in medicine. He is finishing his residency in internal medicine and pediatrics at Metro Health in June. And if all goes according to plan, he will stay local and practice as a primary care doctor afterwards. Everyone, please welcome Dr. Germany. Hi there, Dr. Germany.
Hey, Mike, how are you?
I'm doing great. Thanks for coming on with us.
Anytime. Glad to be here.
So, Marcus, could you give us a quick overview of what drew you to the medical field and made you want to become a doctor?
Sure. For actually a long time, I thought I was going to be a teacher. Going towards the end of high school, juniors and seniors in high school, and I didn't enjoy it too much. So I still wanted to work with children, but I did some shadowing with my pediatrician at the time and decided to pursue that route. So I finished, like Mike said, I finished medical school and I'm finishing residency in June. And if all goes to plan, I'll be a clinic and community pediatrician and internist.
That's fantastic. So I remember you talking about med school a little bit at the library. While you work at the library, was that the time you had already decided? Did you decide at that time, or?
I think it was after I had finished working at the library. I think I decided kind of late my senior year what I wanted to do in life. So it's okay to change, I guess. If you think you're going one way and you decide to take a different direction, it's okay.
Absolutely. So even though we're glad you're a doctor, especially right now, you did start your career in the library. So we encourage everybody to think about becoming a librarian. Welcome, Marcus. I'm so glad that you're joining us this evening. So I want to know, it's been about 11 months, of course, since the coronavirus has started and things have closed down, and we're working on, of course, trying to control the virus and make sure everybody socially distances and everything. So I think, though, doctors and health professionals were dealing with this before March. So in what ways, since last year, in what ways has the pandemic changed what your experience has been in working at the hospital?
Sure. I think back to last year, and I think it's safe to say that we were dealing with the pandemic before we knew we were dealing with the pandemic. We had, just talking to some of my coworkers and colleagues, that we had quite a bit number of patients that came in were very sick. And they had signs and symptoms of the flu, but they tested negative for the flu. So we really didn't know what we were dealing with until the cases started to go up. We developed a test for the virus, and we knew then that those patients that we saw, the really sick patients that we couldn't get a handle on, probably had COVID, and we just didn't know it yet. Okay. So going through last spring into the summer, things had, they had spiked and then they had kind of calmed down a little bit. But going into the fall and winter, we started to see a surge and a very high number of cases at a single time. So we actually enacted at my hospital and other hospitals around the city in the country, different surge plans for patients and admission protocols. And it pretty much shook everything that we knew as a normal workflow or throughput kind of up in the air, and it turned itself on its head. We're still seeing a pretty decent number of patients with coronavirus being diagnosed and testing positive. And we're also seeing a number of people who are still exhibiting symptoms, but not testing positive. So we still have to kind of assume that they're likely to have it, although their test is negative. Now, that's to say that no medical test is 100% accurate at any point in time, and this is no different. So we have to do our due diligence and still care for those patients, even though that all the data suggests that they may not have it. We still have to keep it in the back of our minds.
Okay.
And so even now in the current month of February 21, we still see COVID patients, but the numbers are steadily coming down, thankfully. I think the vaccine and just social guidelines have greatly impacted that. So we're starting to see our numbers head in the right direction.
Good, good.
Yeah, just this afternoon, I think Governor DeWine took the curfew away. So the curfew is more, and that's based on hospitalizations over a 7-day period having dropped below certain levels. So it sounds like you're seeing what he's saying that the data is telling. So that's good. And one of the things giving us hope in combating the COVID-19 virus and pandemic is the expedited rollout of the vaccines. Studies show they've been very effective in preventing COVID symptoms, and well, it was really less than a year that they put all these out. And my understanding is it usually takes a vaccine twice as long as that to really get out and put into full force. So there will be plenty of people wary of the vaccines and their side effects, especially having it come in so quick of a fashion. So a couple questions: have you been vaccinated? And if so, what side effects did you experience? And have you heard of others having the same type of thing?
Yeah, so as being a healthcare worker, I was part of the first phase, or the kind of the initial cohort to get vaccinated. And I was vaccinated on December 18th, I think. That's when I got my first shot of the Pfizer kind of series, and then January 7th, 8th, somewhere in the first full week of January, I got the second dose in the Pfizer sequence. And I'll tell you, the first dose went fine. I get the flu shot every year, and that flu shot actually hurt worse than the first dose of the Pfizer vaccine.
Wow.
I know, and it was unremarkable because I'm like, I don't know what to expect, what it's going to do. I'm going to be down for the count. But the first dose was fine. The second dose hit me a little harder. There was more pain at the injection site, and I experienced just fatigue and a slight headache. It was nothing that night in with some fluids and a good meal couldn't fix. Got a good night's sleep, woke up the next day, was just fine. So mild symptoms for me, and I hear that others who've gotten the shot have experienced similar symptoms. Some of them have had muscle aches, fatigue, headaches, and then again, the prolonged pain at the injection site. And again, it's nothing that, what we call supportive care, Motrin, Tylenol, fluids, and staying, keeping yourself nourished can't figure. The most severe side effects that I've heard, and these are quite rare. I don't even have the data memorized, but it's way less than 1%. Is that some people had an allergic reaction, but not anaphylactic, which means they developed a rash or they had some trouble breathing, but they were never in any true anaphylaxis or risk of respiratory compromise. So those are the symptoms that are most severe, but they are extremely, extremely infrequent.
And what you're saying are things that I've heard. The 1% is isn't that kind of a universal thing for pretty much any vaccine? There's going to be people with reactions, with allergic reactions, but I've heard the 1% is usually the number for any of that.
And it's Mike, it's well under 1%. It's a decimal, a fraction of even 1% who experience kind of the severe symptoms that we've been hearing. And then I hear people have concerns with allergies, that egg allergies or penicillin allergies, that those aren't contraindications, or those shouldn't preclude you from getting the vaccine.
So Dr. Germany and Mike, we've been getting a couple of questions on Facebook. So if you don't mind, I can jump in with a couple of Facebook questions.
Sure.
Here's a couple of questions. Is there any difference between side effects for people of color versus European folks? And a question from the Facebook user is there anything at all that we should be afraid of?
To answer both of those questions, there are no reported differences in side effects from the virus. I'm sorry, for the vaccine. There are no difference in reported side effects for the vaccine for people of color and people of Caucasian descent. And the second question was, is there anything to be afraid of? And I think the answer is yes. I think you should be afraid of not being educated about the vaccine and letting this opportunity go by and you receiving the wrong information. Regarding the vaccine, I encourage people to reach out to trusted sources like their own doctor or their own hospital institution where they get their regular health information and consult with those providers rather than untrusted sources throughout the internet and beyond.
Okay.
As far as the vaccine goes, I don't think there's anything that anyone should be so afraid of that would preclude them from getting it. So like I said, I think that the biggest thing you should fear is receiving the wrong information and letting that be the reason that you put yourself at risk.
And that's why we have you here today, because libraries, our number one job is to provide information, make sure that people have access to the best information possible. So we're so appreciative that you're here this evening, which, since you answered that question, my next question was about myths and misconceptions. So what are some of the myths and misconceptions that you hear around the vaccine? And please don't talk about the zombie.
No. Working in internal medicine with the adults and in pediatrics with children and adolescents, I hear a wide range of misconceptions. Mothers come to me and worry that they can't get the shot when they're either pregnant or breastfeeding, and that is simply not true. That the shot is what we call a killed vaccine, or it's inactivated, which means that it does not pose a risk to the baby if it's not born yet or if you're breastfeeding. So we actually encourage mothers to get the shot who are pregnant or breastfeeding. It works much like the flu shot in that immunity for the mother portrays immunity for the baby. In terms of my adolescent crew, is that they can't wait to get the shot so they can walk around without a mask and do whatever they want in large numbers. And right now, I know we're going in the right direction, and we want to keep going in the right direction. As of now, we still need to wear our masks, be mindful of our distancing, and staying away from large groups, whether we are congregating or just happen to be in a large gathering.
Okay.
We still need to do our part in the early stages because of two reasons, really. Not everyone has been vaccinated, and especially for the older crew. And the vaccine is not, like I said before, 100% effective. It's about 95%, which is stellar, but it is not a foolproof method to protect yourself. So we need to let the vaccine and ourselves do the work. And then lastly, some of the misconceptions that I hear from my older crew, especially those with chronic diseases like high blood pressure and diabetes, is that they should not get the vaccine because of those conditions, when in fact it's the exact opposite. And that if you have chronic diseases such as those two, hypertension or high blood pressure, diabetes, obesity, liver disease, things that make you more susceptible to infection, you should be chomping at the bit to get this vaccine, because unfortunately, those people with the chronic illnesses are most likely not only to have a severe case from the virus, but actually die from it. So we encourage everyone, including and especially those with chronic diseases, to seriously consider getting the shot.
So early data suggests that minorities and people of color, especially African Americans, are refusing to take the vaccine at rates higher than expected. And this is particularly alarming as Black people are more likely to be hospitalized and more likely to die from COVID. And I'm sure you deal with this in your work every day. People asking you questions about it, doubting what they should do. So what do you tell your patients about the vaccine to educate and reassure them?
I definitely start by saying where the patient is and what he or she understands about the vaccine before I give any information. It's an open-ended discussion aimed at me wanting to provide as much information that the patient wants to hear. That I will never shove information down someone's throat or force them to do something that they are not willing to do. So I definitely start by making sure that they understand what they think they understand. And then I gently probe them and see if I can give them some more information. Do you understand, the risk of the virus versus the risk of the vaccine and the benefits of the vaccine? I can't say there's a benefit to the virus. But I think that the most important thing that I try and impress upon my patients is that we know what the virus can do, especially to people of color, minorities, African Americans, the whole run of the gamut. We know that they disproportionately need to be hospitalized, they have a more severe illness, and they're more likely to die from the virus. And so once they understand that, I try and flip it to what you understand about the vaccine. And a lot of things that people say they've heard from the vaccine about the vaccine is it's just not true. And then we try and educate our patients to get the best information from the best sources. And oftentimes that unfortunately the loudest sources aren't always the best. So I impress upon them is that to take my story as an example, I was not gung-ho about this vaccine in the beginning. I'll be quite honest. I was leery. I was like, here we go again, more issues in healthcare. But the more I learned about it through work and everything else, I decided that it was too great a risk to pose to not only myself, but to my family and to my patients. And that this vaccine was something that I had to do.
Okay.
I read up on the side effects, the potential side effects, and the risks and the benefits, and it was a clear choice that the vaccine was the only option for me. So I try and impress upon them like that was my journey, that I wasn't always gung-ho, and then the side effects that I've spoken about, what I've experienced and what most people experience, and then I give them kind of like the worst case scenario. You know, once you get the vaccine, it's pretty standard practice that you're monitored for a length of time to make sure you don't have one of those scary reactions, because those typically show themselves in about the first 10 to 15 minutes up to about a half hour if you're going to have some life-threatening reaction typically. So I try and lay as many fears as I can, but still give as much information that the patient wants to know. And you know, at the end of the day, if the patient still says that they don't want it, that's completely fine. I'm just reassured that they have the information, that they can make their own decisions. Mm-hmm. And I let them know that you not wanting it now does not mean that you can never get it. So I give them kind of a reassurance that you can change your mind about this.
So a couple more Facebook questions, Dr. Germany.
Sure.
Can you provide us an update about what's going on with teens and children as far as their timeline for getting the vaccine? And then we evidently have a scientist on the chat, because the question is, since 2 of the vaccines are from mRNA, is there any possibility of changes to our DNA structure?
Sure. As far as children and adolescents go, it's not currently approved. I think the 2 shots are different. One is approved for age 16 and one is approved for age 18 and up, and I can't remember which one is which. We're not vaccinating them just yet. We have to get we're working in a phased approach in the state of Ohio. Mm-hmm. And it's kind of a reverse kind of age or reverse chronicity, in that the older people are getting vaccinated first, and then we'll trickle down to the younger crowd, which is why it's especially important that we still follow the same things that we've been doing for a year, being mindful of our distancing, wearing our mask, and just staying off of the social scene as much as we can. As far as the vaccine being an mRNA-based vaccine, this is actually not the first mRNA vaccine that we've had. It's probably the most publicized and widely known now, but other vaccines that we've had in the past are using the same technology. And to be quite frankly clear, there is absolutely no chance that this will alter our DNA. The relationship between, going back to the basic science, relationship between mRNA and DNA is related, but that is through a completely different mechanism that is not have anything to do with a vaccine versus human DNA. So your DNA cannot be altered with this vaccine.
Okay.
So no one will become Captain America or worse.
Well, not from the vaccine, they won't. Maybe it's through a different mechanism, but not from the vaccine. I'm sorry to say we won't get the shield and colors with this.
Okay. So I watched one of your presentations that you did for work on the distrust with the African-American community. And I know that this goes back to the Tuskegee experiment, but I also know that even currently, a lot of African-Americans don't have the best experience when they go to the doctor. And so there are some trust issues, and it's not related to something that happened years and years ago. Is more current. So how can we, you mentioned fear. So how can we overcome that fear? how can we trust our healthcare professionals? What types of questions should we be asking when we go to the doctor if you are an African-American person?
Sure. Yeah, I did a presentation regarding African Americans and their mistrusting relationship with healthcare, and I'll tell you that this vaccine is no different than what I experienced with the flu shot. As a pediatrician, I get to the unfortunate, I guess, opportunity to poke the kids, make sure that they're all healthy and well enough to go to school and help these communicable diseases that were once rampant in the past now are pretty much gone from the population. But I do get a lot of pushback on or about the flu shot, and it's a generational thing. This person says that my mother never got it, her mother never got it, this person's grandfather never got it, so they're not taking it, and they don't want their kids to take it. And once I have that conversation, it's like, well, why? And oftentimes the answer I get is that it's just something that we just don't do, which is fine. I totally respect that, but I again probe the patient and see if they like to learn more. If they're willing, fantastic. If they're not, that's fantastic too. But I make sure that they know that if they want the real answer, I will help them discover it in a non-biased way. Would I like to see everyone take the flu shot? Sure, I'd love to see everyone who is willing to get it. And that's the same attitude that I approach the coronavirus shot with. And if you are willing to get it, I will want to help you get it. And if you're not willing to get it, I am willing to help you stay safe, even though you don't want it. But those people kind of who seem skeptical about either the shot or anything else that's medical, I like to take some time and address that there was a rough relationship between healthcare and Black people, especially in the past. Let them know what has changed since then, because that's the missing piece. See, people understand that there was an issue, and now they think there's still an issue, but there's this wide area of time that many people don't know about, and that we do need more African American participation in our studies and research, so that incidents just like this vaccine can be better studied and more appropriated for people of color and minorities. So going back to the mistrust, I try and put myself as an ally or a trusted a partner in their healthcare. Being African American myself, I think that it allays some patients' fears that I can trust him. He knows what he's doing, or he understands where I might kind of falter in terms of I don't really trust these medical people because of previous issues. And I tell them that it's not just me, that all of my colleagues, no matter what they look like or no matter what their background is, that we all work towards the common good. Mm-hmm. And I try and make them laugh with that, telling them that medicine is probably one of the only specialties that works to put itself out of business, that the better job that I do means that it's going to be harder for me to keep my job. If most people are healthy, they don't need to come see me. That means I can't make money, and then I'll be out of work. So that's my kind of my line to make people feel more comfortable, is that I'm doing the best I can, no matter what, even if that means me going theoretically out of business.
Well, I think it hurts, and I truly appreciate you saying that. When you first heard about it, you had some concerns too, and I think that helps as people make decisions, knowing that you went through a process as well. You had to, once you learned about the vaccine, you felt some anxiety, and you said, okay, let me learn, let me do my research, let me get the facts, and then make a decision. And I think that's what we want everybody to do. Get the facts. Don't just, go off what you see on, some crazy internet site or something.
Exactly.
Make sure you ask the questions. Okay, but I'm sorry, Mike, go ahead. You're supposed to be asking the question.
Well, we're on to the last question that we have for Marcus. If anybody else
Facebook
wants to throw any on the Facebook, we'll still have time to answer those. Or if you're watching this after we've recorded it, you can put them in the comments and we'll get to them, or even call or send an email to the library to ask us. But Dr. Germany, let's look at a little bit ahead to the future and hopefully better times. What's your outlook on the future as it relates to COVID? How can we get back to a normal way of living?
Sure. I think today's news that we were discussing, Mike, is wonderfully promising. That this ban on, or the curfew and the ban on, I guess, kind of curtailed services is lifted. And I can almost promise you that this ban or this resolution was not taken lightly, that the governor was not under any special pressure to make this happen, that he studied the data, looked at the trends, and determined that not only now, but weeks beyond, we are in a better place than we were. And that's why he decided to lift the ban or allowed it to go into effect today. So I think that's, kind of today's what good news do you have for me? Going forward, it is going to get warmer, we hope. So we can kind of spread out more. We're not all clustered and crammed inside. The vaccine, of course, is a literal godsend in that we are working tirelessly to get as many people vaccinated as quickly as we can get them vaccinated as possible. I was one who didn't want to take any trips or any vacations until this was resolved. And myself, I'm looking towards the future and trying to plan some vacations for myself because A, I need some time away. This has been a very challenging time, and B, I think that we're getting to a place where it is okay to start planning vacations and starting to get back to a normal way of living. Maybe not immediately, but towards the future as we get to
not tomorrow.
Not tomorrow, exactly. Not tomorrow, but in a few tomorrows from tomorrow, we can start to look for some travel destinations just to see, and be mindful and be very safe and respectful of everyone in their space and their preference. But it's good to look forward to start planning some trips and getting back to something of a good way of life.
Well, I was just chatting with my sister today. She lives in Florida, and I haven't visited there in about 3 years. And I told her, you know what? Her birthday is in May. Toward the end of May, I have the week of her birthday off. I said, should I come down and visit you on your birthday week? And she said, well, let's see how the vaccine is working in Florida around that time, because we know Florida, we hear a lot of stories about how Florida is doing very well, or as well as others. So now I can tell her, well, I know a doctor that said, it's time to start thinking about those vacations, start planning for those a few months in advance. So,
and just to make sure I'm clear, we're not going tomorrow.
Yeah, not
we're
tomorrow.
Definitely not going tomorrow, but we can at least start to look towards it. Even if we still need to wear masks and practice good distancing, we can start to plan. Look ahead. The future is looking pretty bright as long as we take care of business now.
Wow.
Right. Yeah, that's about the end of May. So that might be around the time you start doing those things.
So we've got a couple Facebook questions. The first one is, do you think that since we haven't been the guinea pigs for other vaccines, that is what is causing such concern about this vaccine?
Are we talking about we as in people of color and minorities, or we as in?
I'm not sure. I think
okay.
That's I was trying to, Melissa, if you want to clarify your question a little bit for us. I think I know where you're going with this, but are you referring to the fact that we weren't? I'm assuming, Marcus, that most vaccination processes require some study, which involves human trials at some point.
Sure. Well, these vaccines were definitely studied pretty robustly. I think that one of the issues is that we didn't hear much about the vaccine in terms of the research and the analysis and all of the kind of the scientific things. We kind of heard that there's a shot, it's been tested, now you can get it, and then the details were kind of left out just for, I guess, science's sake. It is true that African Americans were not as represented in the studies than other groups, especially white people. But that is no different than any other vaccine. African Americans historically are underrepresented in not only the studies of vaccines, but medical studies in general.
Okay.
So that I think that, and again, going back to the DNA question, it doesn't alter DNA, and it doesn't matter what your DNA makeup is, whether you are of this ethnic group or this cultural group, whatever. The vaccine should provide as much protection as it would for you as it would for anyone else who receives it.
So I think just to clarify, I think Melissa was referring to a certain generation, meaning that for generations, Caucasian grandparents, great grandparents took vaccinations. They were the first. So that made Caucasians more comfortable taking the vaccine, whereas that may not have been the same experience for African Americans.
Yes,
So
I agree with that.
we
Yes.
got that one right,
Yes.
Melissa. We're missing something. Put another question in the comments. The other question is one vaccine better than the other, Pfizer or Moderna? Whenever I hear people talk about getting their vaccine, the first question I hear people ask is, which one did you get? And I wonder why.
Mm-hmm. So that's a great question. That there are two brands of the vaccine, but they and there is a slight difference in how it protects you against the virus. And by slight, I mean it is not clinically significant. I myself received the Pfizer vaccine because it was the first one to be approved and distributed. A large number of my colleagues received the Moderna version. It really makes no difference which one you take. Like again, the studies, and I think the difference comes from the difference in the number of studies and the number of patients enrolled. The biggest difference is that the timing of the second dose differs for Pfizer and Moderna. For Pfizer, you get your first dose, and then you get your second dose 3 weeks later, and I believe for Moderna, it's 4 weeks later. That's really the only difference between the two.
Days.
Yes, 21 for Pfizer versus 28 for Moderna, and again, the side effect profiles, the overall protection against disease, they can never be exactly equivalent, but they are as equivalent as they can be without making what we call a clinical significance or making one safer or less safe than the other.
So Dr. Germany, is there one or the other, are there more doses available for one of the companies versus the other? Is the rollout quicker for one or the other? Is that one of the reasons why you get one or the other one?
I don't know where each company is in their manufacturing. I'm sure they're working tirelessly to get these doses out. I'm wondering if there's like a contractual kind of arrangement with certain distribution sites with one company over the other. And I think that could be why, maybe this retail provider only offers Moderna and this one offers Pfizer. I think it has to do with kind of the behind the scenes distribution aspects.
Yeah, I would imagine it's like if you go to the Browns game, they only serve Pepsi or Coke products, one or the other. That's the contract. That's what you get. You don't go to the doctor and say, I want this instead of that vaccine.
Exactly.
So you started off saying that the shot was less painful than the flu shot, but so that's kind of my fear. I'm like, how painful is this shot going to be? So give us a scale, Dr. Germany.
Sure.
1 to 10, with 10 being the most painful. Where does this shot fall at?
I like to think that I have a high pain tolerance, but those who know me best probably disagree with that. I'll tell you what it felt like. The shot feels like it's a kind of a chronic or just incessant cramping, and that your muscle just feels tight. I got it right in the left arm, and it just felt really, really tight. Like it wouldn't. There was like a cramp that just wouldn't release. And I could I could still move it and bend it and use it and write and drive and all the other things, but it was just you could tell you got a shot in that arm.
So like a shot from when you were a kid.
Yep. If you let the kids tell it, especially the older ones, the shots are like the worst thing in the world. And they sit there, you give them the shot, and then they're like, well, when are you going to do it? And you're wash your hands saying it's over. So
my brother,
Germany, I hope it's like that when I go to get my vaccination.
It's to be very transparent, some of my coworkers did require it. They were experiencing some symptoms that made them uncomfortable coming to work the next day, which is completely understandable. That if they were too sick to care for themselves, they could care for other people. So, especially for the second shot, people were telling me that a day off was much needed because of the timing of the symptoms that they felt. Some of them got it overnight, which means it carried over into the morning. and they just weren't ready to go for the next day of work.
My brother, who's a firefighter, he already got the vaccine since they were one of the first to be able to do that. And I think he got it early January, very early January. And he said the same thing as you. His arm was sore for like 24 hours, and that was about it for him. But yeah, that sounds like the most common thing that I've been hearing people say, their arm sore. You know, like you said, you can drive, you can do everything else that you usually do. It's just it hurts for a day or so.
Yep. And it's nagging. It's there. You know it's there. You get the headaches and muscle pains. You know you're having these symptoms, but that's reassurance that your immune system is doing its job. It's conferring immunity to this virus. And you, as much as they are inconvenient and they stink, you want that to happen. You want to feel some evidence like, it's working now. It's working.
So another question is, one of the Facebook participants, Kelly, says she just saw an article that said Joe Biden thinks all Americans will be vaccinated by July. If that happens, when will the quarantine be lifted?
Tough question. I've heard different estimates that we can all be vaccinated by the end of summer, to where it may take into 2022, to where Joe Biden wants 100 million Americans vaccinated in his first 100 days in office. I don't know.
Okay.
I have no idea where we'll be in 3 months, 6 months, or at the end of the year. I'm hoping that we'll be ahead of schedule. Of whose schedule, I don't know, but I'm hoping that we can surprise ourselves and get this thing done.
Right. But that will help. The more of us that participate when it's our turn, the faster we can get this process done.
Yeah. And I know that we're early in the process, and we're still needing to work out kinks and scheduling from a variety of perspectives. But patience and time will definitely lead to eradication of this issue and getting back to where we want to be and where we need to be in our lives. I just personally don't know when we're going to get there. But patience and acceptance are all that we in healthcare ask for.
Well, as we talked about earlier, Ohio lifted their curfew earlier today. So in Ohio, there is no more curfew. There is no quarantine. Though I think the real nationwide issue, there's some states that have different levels of curfews or quarantines, whatever you want to call them. I think the real national issue is schools. Pretty much nationwide, schools are not fully open. So getting to that level is probably the next step.
Yep, and I think part of the governor's plan into expediting access to the vaccine for school workers is that we can move to at least a hybrid model with some in-person education before this academic year has gone. And I hope that we can at least be trending towards an all in-person model when the next academic year starts.
Yeah, I think most schools around here, your alma mater, right next door to the library, just reopened on a hybrid model last week, I believe. Then pretty much most other schools, I know Lakewood opened a month or so ago on a hybrid level, and most other schools around have done that on a hybrid level. If they haven't fully reopened, I think, what school did I just read? Maybe Fairport Harbor, somebody in Lake County, I think, says they're full blow on February 16th. They're ready to fully reopen.
All right.
I forget which school it was, so I don't want to say the one I said a minute ago, because it might be wrong. But yeah, one of those schools said they're ready to go. So schools are chopping at the bit to go. They all want to be sure that they're safe.
And I think parents are chopping at the bit as well.
Yeah.
Absolutely. So we just posted in the, Carla just posted in the Facebook chat the link for more information to go if you want to connect to the CDC or the Ohio Department of Health and find out where you can go to get a vaccine shot. Again, as Dr. Germany said, feel free to contact your healthcare professional directly if you have any questions or concerns. But the best way to start this process is to simply get the facts, get the information that you need. So what else are we missing, Dr. Germany? We talked about the myths, we talked about the pain level. talked about the difference between African Americans and others. Anything else we want to make sure we mention before we get off the Facebook chat today?
I think we hit the highest or the most important parts, in that the vaccine is here to serve and protect us. It is not to cause us more harm than the virus, certainly. And that is certainly something that everyone should consider, especially those with chronic conditions like we spoke about, that we should strongly consider getting the vaccine, and that patience and time, not only with the vaccine, but with what I hope is the end of the pandemic, and that we still need to be mindful of our social responsibility to help end this thing, and that brighter future is coming. I think we'll be not only where we were, but in a better place, so that we can still enjoy the vacations and the family time and et cetera. So I think we're heading in the right direction, and of course the governor's actions today support that.
Right.
So I encourage everyone to reach out to a trusted source, learn more about the vaccine, and learn how you can and when you're eligible to get the vaccine, and where you can receive it.
I was thinking the other day that the chickenpox vaccine came out in like 96 or 97, somewhere around there. And so many of us, when we were children, we didn't have that opportunity to take the chickenpox vaccine. But I remember doing my research, because I had children. My children were young then, and I remember doing that research and wanting to make sure that, I made the best decision for my children as far as the chickenpox vaccine. But what I remember the most about my decision is I hated when I had the chickenpox. It was horrible.
Oh yeah.
I didn't want my kids to ever have to experience the chickenpox at all. And so I feel the same way about this. It seems like COVID is horrible, and we don't want people to have to experience that level of sickness. And so, get the information that you need so that you can make an informed decision about the vaccine.
You're right. And I think that the difference between chickenpox and COVID is that, you experience chickenpox. A lot of people experience chickenpox and are alive to tell about it. Right. Whereas with COVID, I think a grave number of people experience COVID and will never live to tell about it. And I think that many would agree, of those who who had it and were fortunate enough to survive, is that is not something that they would wish on anyone. And if there's anything that could have helped protect them from getting it in the first place, they'd probably be first in line to receive it, such as this vaccine. And you were mentioning chickenpox. We've in history, we've gone through this with smallpox, the creation of a vaccine. We've gone through this with chickenpox. I actually was born in the early 90s, just before the vaccine came out, and I just missed it. I just missed being eligible, and I had chickenpox. And it's something that virtually no one has. As being someone who had it as a kid, it is probably one of the few diseases that I will ever be able to say that I had it, and you won't get it if you get the varicella or the chickenpox vaccine. So it's interesting to be able to kind of have that perspective, that people who were around or know people who were around during the smallpox and other pandemics.
We've lived through these types of situations before. So
yeah, I had the chickenpox in like first grade, and I remember that was a thing. People had mumps, measles, chickenpox. All my classmates seemed like every week or so somebody was out for several days. And you remember me, Marcus, as a big baseball fan, I'm sure. So my goal this year is to be able to get to a ball game sometime this season.
At least one.
Yeah, we got all the way till September at least, and the Indians sometimes are playing into October, so it's several months off that we have that window. So hopefully we can get everybody vaccinated.
Definitely,
and things will be things you can do without worrying about again.
Certainly.
Well, thank you so much, Dr. Germany, for joining us this evening. We appreciate all the information. We invite you to come back to the library.
Certainly. On my rare off days, I'll step up and see how everyone's doing.
They'd love to see you. You'd only be
Yeah.
able to come to the front desk right now, but they'd still love to see you.
That's right.
If you come, be safe, wear your mask.
Of
Yes.
course. Of course.
All right, well.
Well, thank you so much for having me. This has been very, this is fun. This is fun. I appreciate everyone's questions.
Yeah,
Yes.
and thank all of our Facebook participants. Thank you for chiming in tonight. And as Mike said, if you watch this later on, go ahead and put your questions in the chat box, and we'll try to get them answered for you. But we want you to have a great evening. Stay safe. Make sure you wear your mask. Practice your social distancing, and we'll see you soon.
Thanks, everyone.
Take care. Bye-bye.